Okay, today we are going to see about three series codes, which means respiratory and cardiovascular system of surgery topic. Okay, so first we are going to see about the respiratory system. In that respiratory system, what are the anatomical part involving that image they have given here? So you can check sphenoidal sinus, nasal cavity, pharynx, alveoli, right lung, diaphragm, then frontal sinus, nasal conchae, then nose, larynx, trachea, bronchus, bronchioles, left lung. These and all will involve in this respiratory system. Along with that, some other system, some other anatomical part also is there. We will see in the further on. Okay, first we are going to see about the sinus. So you can see the sinus image they have given here. So first one is a frontal sinus, which will be it will be located in the forehead area. So that is a frontal sinus. And next one, ethmoidal sinus. It will be located in the um, um, back side of the nose. Okay. Then sphenoidal sinus, that will be connected with that this place, near to ear area. Okay. Then fourth one, maxillary sinus. This maxillary sinus exactly near to the nose area. Okay. So in our cheek area, it will be connected to the nose area. So you can see that the nose image they have given inner part, whatever anatomical part involving. So first one, this frontal sinuses will be located here, and the sphenoid sinuses were located here. In the nose area, there is a three turbinates will be there. That is, the first one is a superior turbinate, and the second one is a middle turbinate, and the third one is a inferior turbinate. These turbinates only will supporting to filtering the air whatever we are inhaling. Okay, so if in case any abnormal unwanted things, if we inhaled, means first this turbinates only filter that, and it will allow the um, filtered air to our lung. Okay, then next one is a nasal cavity and nasal vestibule. Okay, then back side of the nose, so these are the anatomical parts involving, that is adenoid pad, then fossa of Rosenmuller, then nasopharynx, then choana, then Eustachian tube orifice. Okay, so you can see here that abnormality they have given happen in the nasal turbinate. If in case any infection happen, means that a nasal turbinate will get inflamed, so it will block the nose. So that is a condition. So next one, um, repair of the vestibular stenosis they have given here. So some patients have that this bone will be there, no, that in between bone will be there. So that bone arrangement is not correct. If in case it is a narrow space only there, means that time the physician will adjust the space of the bone. Okay, so in that scenario, they will do this graft method. So they will make a cut in that bone, and they will add some graft, which means um, artificial bone or their same body own cartilage bone. They will insert here, and they will make a space between that narrowest space. Okay, so this is a repair of the vestibular stenosis. Then a nasal implant. If in case somebody has some abnormality like this a narrow space, or that difficulty of the some muscle overgrowth, in that scenario, they will place this implant to um, support our respiration process, which means that while inhaling that whatever amount we needed of that air, that will allow. Okay. If that tissue growth is there, or abnormal alignment of the bone is present, means in that scenario it will be affect the inhalation of the air. So the quantity of the air inhalation, it will be reduced. So in that time they will add the this implant support to allow the that sufficient amount of air inhalation. Okay. So then next one, they have given a CPTs. What are the CPTs we are coding, and what are the concepts we are following in this endoscope ethmoidectomy concepts they have given here. So for an example, this ethmoidectomy anterior or posterior partial means we are using this 31254. If in case that is anterior and posterior means that is called as a total ethmoidectomy, that we can use the CPT 31255. Like that they have given a one sinus, how what are the CPTs we are using, that one they have given here. For that ethmoidectomy they are performing a total for plus frontal sinus exploration means the CPT 31253, and along with that this total spinoidotomy performed means 257. So here spinoidotomy with the tissue removal means this CPT 31259. Like that they have given here maxillary antrostomy means the CPT, with the tissue removal means the CPT, frontal sinus explorations, sphenoid sinusotomy, those and all they have given a individual CPTs. Whenever combined procedure they are performing, like total ethmoidectomy plus sphenoidotomy with the tissue removal. So this one 31259, ethmoidectomy with the sphenoidotomy with the tissue removal means we are using 31259. Okay. And maxillary antrostomy and frontal exploration performed means how we have to code, they have given here. So 31259 and 256 for maxillary antrostomy, and frontal sinus exploration means 276. That one they have given here. So like that we have to code. Then next concept is laryngoscopy. Laryngoscopy means there is a type. First one is a direct laryngoscopy. Then another one is a indirect laryngoscopy. So we can see this image, direct and indirect. Direct means by using this equipments, they are opening the mouth, and directly they are visualizing the um, larynx through the naked eye. But indirect visualization means by using some these instruments, by visualizing this scopies, they can able to see the larynx by the screen of some computer assisted system. Okay. So that only they are telling here, insertion of endotracheal tube by the method directly visualizing the vocal guards by the naked eyes. Indirect laryngoscopy means insertion of endotracheal tube by the method of indirectly visualizing the vocal guard, either the video camera or mirrors. They will use the mirrors. Okay. Then in this laryngoscopy itself, we have two methods. This rigid and flexible. So that by the word itself we can understand rigid means it is very strong. It is not a flexible one, and another one is a flexible one. Okay. So this rigid laryngoscopy, it is passed through that tube-like structure is passed through the patient's mouth, and they will examine the that larynx, and they will checking the voice box and all. Then in this one they will take by the video, so they can check. It is also called as a telescopic laryngoscopy and transoral laryngoscopy. Then flexible laryngoscopy, they will they will use that video imaging only, but by movement they will take the image. But in this method, by they won't allow the tongue to move, so it is a rigid laryngoscopy. But in this flexible laryngoscopy, by using the voice box in action, they will take the image. So how it is working like that. So they will ask to the patient to speak, sing, like that they will ask to do the activities. In that time they will take the image and they will examine. That is a flexible laryngoscopy. Okay, so in this they can check the their capacity while speaks, sings, coughs, sniffs, those and all they will check. So this flexible laryngoscopy also called as a fiber optic laryngoscopy, then fiber optic flexible endoscopy, nasopharyngoscopy, transnasal laryngoscopy. These and all other names for the this flexible laryngoscopy. Then stroposcopy. So stroposcopy means a stroposcope, also known as a strobe, is an instrument to make a cyclically moving object appear to slow moving or stationary. So they will check how it is moving those and all by using the strobes. They will check the image. So in this they will have that rotating disc with a slot or hole or lamp like structure in this tube. Okay, so they will insert the tube and they will by using that flashlight they will take the image. That is a stroposcopy. Then next one, thoracentesis. Thoracentesis means by inserting needle, they are collecting the unwanted air or fluid from this pleural space. That is called as a thoracentesis. So lung area or pleural space, they are removing that unwanted air and fluid means that is thoracentesis. We have a CPT series 32554 and 32555. You can see the image. This is a that blue color highlighted one is a pleural space. So in this area they are inserting the needle and sucking the unwanted fluid. That excessive amount of fluid will be there, so that one they will remove. Then bronchoscopy means by the word itself we can understand that is by using the bronchoscope they are imaging that bronchus. So bronchoscope is used to the airway. So by passing through the trachea and it will reach the bronchus. Here they have given a bronchial tree and a lung image they have given here. So first one is a larynx one. This is a trachea. Okay, so it is a flexible tube-like structure, and this is a primary bronchi. Then second one is a this is a secondary bronchi. Then this is a tertiary bronchi. Okay, it is tree-like structures only. So that tertiary bronchi divided into so many bronchioles. Okay, so in this place, this is a cardiac notch. This place only heart is present, and these bronchioles we um, connected with this alveolar duct and alveolus. You can see this balloon-like structures. These individual structures are called as alveoli. Okay, so these while inhaling, these structures only will get expand and it will collect the hydrogen and it will remove the carbon dioxide from the blood and it will pass the deoxygenated air to the alveolar duct, and by the duct it will pass through the bronchioles, then bronchi, then trachea. Like that that respiration process will happen. So these pulmonary arteries and pulmonary veins will be connected with the each and every alveoli. So CPT and the bronchoscopic coding, they have given us some instructions we can see here. So previously one concept is there. So that bronchoscopy codes are 31622 31654. Then we have a different codes and we have a NCI edits for that Medicare and non-Medicare patients. So for that previously in the 2016 and all we have some codes for that um, uh, endobronchial ultrasound CPTs for the diagnostic and therapeutic intervention. Then after that, that American Medical Association created three new codes for that. That one they have given here 31652, 653, and 654. For that, this whenever we are coding that endobronchial ultrasound, so how we have to code that one they have given here. So endobronchial ultrasound, transtracheal and transbronchial sampling. So with that biopsy procedures and all they will do, right? Those that one they have given here. Here one or two mediastinal or hilar lymph node station are structures. This one same one, three or more mediastinal or hilar lymph node station and structure. And the third one is add-on code that is for same. Along with that, they are doing that during bronchoscopic diagnostic or therapeutic intervention for the peripheral lesions. Okay, so this is a add-on code. Like that, they have given a new codes for that. Then thoracoscopy. Thoracoscopic means we are visualizing the thorax by the scope. That is a thoracoscopy. So for lung abnormality, heart abnormality and all, they can able to visualize the image of the lung and heart by the thoracoscopy. Then next, anatomy of the lung lobes they have given. Right lung has the three lobes and left lung has the two lobes. So that right lung first lobe is a superior, which means upper lobe, then middle lobe, then inferior lower lobe. Then left lung, superior upper lobe and inferior lower lobe. This is a cardiac notch. And these lobes are divided into multiple segments. That segments they have given here. Why they are giving these segments means if the patient has any lump or mass or nodule or any abnormality, they want to denote the particular site of that lung lobes means by denoting these segments we can identify. That's why they have given a individual segments. You can see this is a S1 apical upper lobe segment. S2 is the posterior upper lobe segment. S3 is the anterior upper lobe segment of the right lung. Like that, we can denote. Okay. So, like that, S6, S9, S8, S4, S5. Like that, they have given a for the right lung. Like that, they have given a upper lobe. So, S1 plus 2 means that nearby lobe. Okay. So, that's why plus 2. Then anterior, superior, inferior, like that, they have given a anterior, medial, basal, lateral, basal, like that they have given. Okay. Then next topic is mediastinum. Mediastinum is a newly identified anatomical part of our chest area. That is a connective tissue. It is connecting that pericardial space and sternal area, and this posterior mediastinum connecting that heart and spine area. Like that, it is located in the um, uh, thoracic cavity area. Okay, so this is a mediastinum. It is a connective tissue. So based on the location, it is divided into three part. So sorry, four part. So you can see this is a superior mediastinum, this is a posterior mediastinum, and middle mediastinum and anterior mediastinum. So mediastinum, that middle mediastinum is the broadest part of the interpleural space. So it is made up of pericardial sac and its contents. Okay, so this middle mediastinum only huge amount. Then next one, pleura. Pleura means this cover of the lung. Okay, so it is this place after covering that lung space, some space will be there. This is a pleura. So in this place, some air and liquids will be there. If it is crossing that limited level, it will be abnormality. So in this pleural space, it is sometimes that fluid accumulation will be there because of any infections or abnormality. In that time, that will be need to treat it. Okay. Then next one, decortication. Decortication means it is like a uh, it is a one procedure for some fibrous capsular structure will cover the lung. So it because of that a lung cannot be expanded. So it will cover the lung and it won't allow to the expansion. So because of that, our respiration will get affected and full entire body will get affected. Okay, so for that they will remove that fibrous layer. So that process is called as a decortication. Okay, so you can see here it is a decortication. Decortication refers to a surgical procedure done to free a fibrous capsule that has formed around the lung. Okay. Then next one, this is a condition for a pulmonary infiltrate. So usually the patient has any infections or any some other abnormalities. Means in that time they usually get this pulmonary infiltrate. So which means they are that in that around the lung, air will be there. But so because of any infections or anything, that accumulation of pus or blood or any other proteins will be located. It will affect the space of the that lung. So you can see the type of the infiltrate they have given. So mostly this pneumonia condition, tuberculosis condition and all, that a pulmonary infiltrate will be occurred. So if it is lesser amount means broncholobular. It is rounded for that one place means it is rounded. Then it is affecting one lobe itself means it is a lobitis. If it is cloudy means this one cloudy infiltrate. Then lobar gaseous pneumonia means in that time also it will affect like this. Then pericysaritis. Pericysaritis means that a particular bronchi they will affect. Those and all type of the infiltrate. Then next one, fluorodesis. Fluorodesis means I said right that pleural area, some fluids will get accumulated. So in that scenario, for removing that, they will do that drainage process. You can see here, they will inject some needles and they will suck the whatever excessive fluid in this place that will drain like this. That process is called as a fluorodesis. And another one condition is bulle. Means I said right that alveoli will be there. So many alveoli will be there. That alveoli, because of any damage, it will get combined and create one mass-like structure that is called as a bulle. Okay, so that individual alveoli will be connected and combine and form the large space is called a bulle. So if it is connected means it will be a mass-like structure. So in that time they cannot breathe by these alveoli. So that's it for that respiratory system. And next one is a cardiovascular system. Coming to cardiovascular system, we can see there is a multiple procedures they are performing. So we are going to see about what are the important one it will be. Okay. So you can see first one is a catheter placement. Uh, so in this catheter placement, if in case any blockage in the arteries or veins, so to avoid that, they will place some catheters. So the type of the catheter, we have a two type. So tunneled catheter, non-tunneled tunneled catheter. So tunneled catheter, we have some tunnels in between the catheters. But non-tunneled means that a single catheter will be there. There won't be a tunnels. Okay, so based on that we can see the non-tunneled catheter means 36556. That CPD description is during placement of central venous catheter, short track developed as the catheter is advanced from the skin entry site and point of the venous cannulation. The catheter tip must be reside the subclavian, innominate or iliac veins, the inferior or superior vena cava or right atrium to be considered a central venous catheter. So central venous catheter means that approach that where we are approaching based on that is central venous catheter they will place. Okay, so you can see this tunneled catheter. So some tunnels will be there. You can see this place, this place, these and all tunneled catheter. So like that, multiple arteries and veins, it will be connected. So where is the place we are approaching? Based on that, we will select that CP test. And the guidelines will be there. You can see to qualify the central venous access catheter or device, the tip of the catheter must be terminate in the subclavian or brachiocephalic or iliac veins, the superior or inferior vena cava or the atrium. These places terminated that catheter only, we can consider that as a central venous catheter. Okay. And the venous access device may be either centrally inserted, which means centrally inserted means the place, jugular vein, subclavian vein, femoral vein, or inferior vena cava. So these are the entry site. Or peripherally inserted means basilic vein, cephalic vein, then saphenous vein entry site. These are the places, they are entry site. This is a terminating site, so these should be the entry sites. The device may be assessed for the either via exposed catheter external to the skin, via subcutaneous port or via subcutaneous pump. So these catheters, they will insert by using this subcutaneous port and the subcutaneous pump. Then this is a main concept for all whatever prosthetic devices and equipments placed means this is the processes happen in the multiple procedures, which means insertion. You can see this is for catheter they have given here, but not only for the catheter, for the pacemaker placements or other devices placement, this all process insertion will be there. So for an example, placement of catheter through the newly established venous access, that is a insertion. Then repair means already inserted. So now we are repairing. Fixing device without a replacement, either catheter or port or pump, other than pharmacological or mechanical correction of intracatheter or pericatheter occlusion. So you can see the example CPT circle. Then partial replacement. Partial replacement means if in case whatever placed one, for an example, catheter is placed, that tunneled catheter, that multiple division will be there means that one division got the blockage means they will remove that one division and they will replace with another one. So that is called as a partial replacement. In this place, complete catheter is not removed. One place only they have removed. Like that, pacemaker also. If in case uh, pacemaker placed in that dual lead is there, single lead only replacement, that is a partial replacement. Then complete replacement means entire device they will remove and replace, that is a complete replacement. Okay, so we can use that complete replacement code for that. Then removal of entire device means this is these two are replacement, but removal means entirely we are removing the device. That is a removal of entire device. Okay. Then next one, pacemaker or implantable defibrillator. So what a pacemaker means, that a pacemaker system with a LEDs includes pulse generator containing electronics and batteries and one or more LEDs. So usually pacemaker we are used to maintain the heart rhythm, which means if some patients has bradycardia, some patients has tachycardia, which means delayed breathing, means delayed rhythm, that cardiac pumping will be there, no, that pumping will be won't be the normal range, that pumping will be slow. So that is a bradycardia. Tachycardia means it will be more fast, so that pulse will be more, that also not good for the health. So in that time they will fix a artificial machine to maintain the cardiac rhythm, that is called as the pacemaker. Okay, so in this pacemaker, it has the electronic some electronics and batteries and LEDs will be there. One or more LEDs will be there. LEDs means this one. So this is a pacemaker here that inside batteries and electronics will be there. and this is a wires. This wires ending with the leads. Okay. Then the lead consists one or more electrodes as well as conductor wires, insulation and fixation mechanisms. Inside electrodes will be there. That electrodes only batteries. Okay. So that is a electrodes. Then pulse generator are placed in a subcutaneous packet created either in a subclavian site or above the abdominal muscle just below the rib cage. So in this place, subclavian area, they will place the pacemaker. Okay. Then leads may be inserted through the vein or they may be placed on the surface of the heart. Then the epicardial location of the leads requires the thoracotomy for insertion. So epicardial locations. These locations only they are opening and they are placing the pacemaker. Okay, and next one defibrillation. Defibrillation means when we will use the defibrillation process. If in case that a cardiac arrest happen or arrhythmia happen, in those scenario, we will do the defibrillation process. For an example, I have given this image. This defibrillation but as like pacemaker, that artificial defibrillator also they are inserting to the body and they will work as like a pacemaker. But when we will use the defibrillation means if a patient got a arrhythmia or this cardiac arrest means in that scenario to activate the heart, they will use the defibrillation. This is to maintain the rhythm. Defibrillator we are using for to activate the heart. Okay. So that is the difference between the heart and sorry pacemaker and the defibrillator. Okay. Then in that single lead, dual lead, multiple lead will be there, no? So you can see in this image, it has two leads. So this one and this one, two leads will be there. Like that, a single lead sometimes they will place, sometimes dual lead, sometimes they will place, then multiple lead. So we can see single lead is a pacemaker or implantable defibrillator with pacing with a sensing function in only one chamber for of the heart is subcutaneous electrode. So that is a single lead. Dual lead means a pacemaker or implantable defibrillator with a pacing and sensing function in only two chambers of the heart. Then multiple lead means a pacemaker or implantable defibrillator with the pacing and sensing function in the three or more chamber of the heart. Okay, that is multiple lead. Then next one, subcutaneous cardiac rhythm monitor. So along with that, this pacemaker placement and removal, those and all, they will check permanent and temporary pacemaker, permanent defibrillator, temporary defibrillator, like that will be the types. Based on that, we can select the CPT. Then subcutaneous cardiac rhythm monitor. Not only that subcutaneous cardiac rhythm monitor will be there. It will monitor the rhythm of the heart functions. Okay, if in case some patients have abnormal cardiac rhythms means to some it won't be regular, but sometimes only they are getting means for those patients they will place this cardiac rhythm monitor to get alert for this abnormal cardiac rhythm. Okay, so they will make a incision, they will place like a stripe or like one monitoring one equipment will be there. That one they will place inside that um, thoracic area and it will get the monitor and it will connected with some um, systemic or a watch like that they will give that, so it will give the alarm to if in case abnormal heartbeat is there, in that time it will monitor and give the alarm to us. Okay, then next one, AV fistula formation. AV fistula means for a dialysis process and all we are making connection with the arteries and veins and um, uh, for the dialysis machine it will connect, and sometimes they will make this direct connection, that is anastomosis, that used to call as anastomosis. Like that also they will do the dialysis process. So if in case artificially any graft created between the arteries and veins means that is arteriovenous fistula. Artery and veins directly connected means that is anastomosis. For not only for this dialysis process, sometimes this anastomosis they can created for some other process also. Okay, this graft, AV fistula graft, will be connected with the dialysis machine, and that purification process will be carried out. Then bone marrow aspiration. Bone marrow aspiration means for any abnormality to identify means they will do that bone marrow aspiration. So usually that bone marrow will create our immune cells, right? So body cells, immune cells and all will be created by the bone marrow. That is a very important anatomical part in our body. So this place any abnormalities or anything they want to check means they want to do the biopsy and those time they will uh, do the this aspiration process. Okay. So for the CPT 38220. For the biopsy purpose they are doing means 38221. Like that we can select the CPT. Next concept is lymph nodes. Lymph nodes means um, in our body we have a immune cells, right? So those immune cells will be taken care by that lymphatic system only. So this lymphatic system will involve in this and it will be transfer the immune cells from our body one place to another place. So wherever required place, those places it will send the immune cells. So lymphatic system is a very important part of our body. So you can see lymph nodes will be located in our entire body. They have given an example: cervical lymph node, supraclavicular lymph node, axillary lymph node, epitrochlear lymph node, then para-aortic lymph node, inguinal lymph node. So these are the places we have a many lymph nodes. They have given examples. Okay. So lymph nodes are the part of our immune system and are involved with the tissue fluid circulation. So they may enlarge for the number of reasons, including infections, malignance, and systemic disease. So normally, for the general examination, all part of the lymph nodes will be assessed. So here, lymph nodes they will check if in case lymphadenopathy or lymph inflammation is there means it is a indication of some infection or any other abnormality is there. So this is a lymphadenopathy. Then normally the lymph nodes are it will be bean shaped means how that beans will be there like that it will be bean shaped and their sizes will be 1 to 2 centimeter. Okay, so if in case it has got an infection or any abnormality in that time it will be get enlarged. Okay, so these lymph nodes only um, activating that immune cells if in case any infection is there means that D cells and B cells activation and all it will taken care by this lymph nodes only. Okay, then next one the main function of the lymphatic system they have given here. So, collect and receive the interstitial fluid, defend the body against the disease, absorb the lipids in your intestine, and bring them into the blood. These are the functions involving in the lymphatic system. So, that lymph node related whatever procedures they are performing, that and all they will give direct codes only. We can understand directly. So that's it for the cardiovascular 3 series codes. Okay.